Sometimes it's really important to put yourself first. It's a 20-minute appointment and a mammogram only takes 5 minutes every 2 years, and it could actually save your life. You must value yourself.
MacArthur Women's Health Centre is excited to speak with Tanya Vojsk, Marketing Manager of BreastScreen New South Wales, South West Sydney Local Health District. Tanya plays a vital role in ensuring women across the region understand the importance of early detection, have access to screening, and feel supported to make empowered choices about their health. We invited Tanya because breast health is a key component of women's overall well-being, and preventative screening is an essential part of the holistic care model we provide here at MacArthur Women's Health Centre. BreastScreen New South Wales is one of our closest and most valued partners. Together, we work to reduce barriers and increase awareness and ensure that every woman in our community has the information and support that they need to prioritise their health. In this conversation, Tanya shares her passion for empowering women, her knowledge, reaching culturally diverse communities and breaking down fears around breast screening. Her work perfectly complements the physical, emotional and educational support offered here at MacArthur Women's Health Centre. And we are grateful for her ongoing commitment to the women's health in MacArthur. Thank you, Tanya, for speaking with us today.
Thank you for having me.
Could you share a little bit with us about your role at BreastScreen New South Wales and what motivates you to work in women's health?
Yes, well, my role is to provide education and support to the women of the local health district, and also to our workers and stakeholders who serve those women in the local health district. And basically my role is to provide education, facilitate group bookings, support women and workers in any way I can so that they understand how important having a breast screen is.
Excellent. And can you tell us why early detection is so critical, especially for women in their 40s, 50s and 60s?
Yes, as a woman gets older, her risk does increase. And so it is important for women, once they are 40, to actually be vigilant, speak to their GP about the importance of breast health and breast screening. Once they turn 50, they need to have their breast screen because 1 in 7 women in New South Wales will get breast cancer during their lifetime. And being a woman and getting older are the 2 biggest risk factors, I'm afraid.
So a lot of women would feel anxious about having those screening done. Can you tell us what messages or reassurance that you can give women to help reduce some of these fears?
Yes, absolutely. Early detection is all about ensuring women that they can remain healthy, they can live a long and healthy life if they do those simple things like having their mammogram every 2 years, especially once they turn 50. Early detection means we can find those cancers when they're very small, and that way treatment is less invasive and more effective.
Excellent. And so BreastScreen New South Wales and MacArthur Women's Health Centre have been strong partners. From your perspective, why is this collaboration so important?
The partnerships with Women Health Centres provide us an avenue to be able to engage with local women, and the local women know that MacArthur Women's Health Centre is a trusted source of health information. So that way we know that the women will then trust our service because we are partnering with an organisation that they trust.
And so what are some of the biggest barriers stopping women from attending screenings, especially women from culturally and linguistically diverse backgrounds, younger women or those with limited healthcare access?
Right, okay. The main barriers would be things like language, knowing how to access a service if English isn't your first language. Also, public transport can be an issue. For women under 40, they're not sure what they need to do about their breast health and who they go to access. And also women with disabilities, they're not sure where they can go and whether we'll be able to screen women in wheelchairs, which we can. So there are many barriers that women do have, but we try very hard to be able to provide that access and make it easier for all women, regardless of their language barriers and socioeconomic status, to attempt free breast screen.
And I also know BreastScreen has got a lot of resources in multiple different languages as well.
Absolutely, yes. We have resources in 21 community languages, so we can provide that, and it's on the BreastScreen New South Wales website, or you can call BreastScreen and we can provide that, send it in the mail or send it via email as well.
So Tanya, we have a lot of women experiencing domestic and family violence access MacArthur Women's Health Centre. The screening process for them may seem a little daunting. Do you have any words of encouragement that you would say to those women?
Yes, most definitely. At BreastScreen, we understand that we do have women that come in who have experienced trauma. So it could be emotional, it could be mental, it could be physical trauma. And so our radiographers and our receptionists are trained to be able to respond to women's different fears and anxieties and to provide an environment that is relaxing and calming for them. Okay, so what I would suggest to any ladies who are anxious about having a mammogram is to actually try and relax, and also have the conversation, particularly with the radiographer, to say that I have gone through some trauma, or I feel nervous about anyone physically touching me, and so that they are aware where the woman's coming from, and then they can also respond in an appropriate, respectful manner towards that woman and communicate with her in a way that will make her feel at ease. So that's, I think, very important.
That's great, and I guess that's another reason why the partnerships between services like MacArthur and BreastScreen are so important. If that woman may not have spoken to anybody before, it may be that you then do a warm referral over to us and we can support her ongoing needs as well.
Yes, yes, yes. And I really think that that's something that we could work on together and develop that relationship to be able to make sure that those women don't sort of slip through the cracks in terms of that support, in terms of their domestic violence experience and getting that help that they need, most definitely.
That's great. And I think the sector has come a long way. Many years ago, we used to work in silos and not really work together very much, but seeing that change has been a very good advancement for our sector.
Yes, yes. And at BreastScreen New South Wales, we do have posters to help support the women as well, because at the end of the day, we are a women's health service. So, you know, that information is there to support women, and we do look at things in a holistic way.
And what are some of the successful strategies or outreach efforts that have helped increase screening rates in the MacArthur area?
Yes, well, we recently partnered actually with MacArthur Women's Health Centre and some of the local community centres such as AB Central to provide a forum during Women's Health Week to provide access to women in the community. And it was a way of bringing other local health district stakeholders in and services. And so women knew that it was like a one-stop shop, and they were able to find information on a variety of women's health services, as well as having their free breast screen, because we had the mobile van there. So it was a very successful partnership.
It was a great event, having so many health services under the one roof. I do agree. It was a great event.
Yes, and I think it's important to also look at women's health in a holistic way and not just sort of compartmentalise sort of parts of their health. And I think if we can look at it that way, everything that a woman does, whether eating, exercise, it all does affect a woman's health as a whole. And so if we can do that in a holistic way and work together, I think it just really benefits the whole community.
I agree, we need to work together.
Absolutely.
So are there any myths or fears that you would like to debunk directly?
Yes, a lot of women seem to think that if they wear a particular bra or a tight bra or wire under the bra, that it's going to cause breast cancer. That's definitely a myth. And a lot of women don't understand the risk that as you get older, and it's not just women with a family history. So 9 out of 10 women whose early breast cancers we do find do not have a family history. So so a lot of women think that, oh, I don't have a family history in my family, therefore I'm not at risk. It's being a woman and getting older, the two biggest risk factors. For those women who do have a strong family history, they are at an individual risk and they really should be diligent, see their GP, discuss their risk factors with their GP, and also have their mammogram and be breast aware. There are all these myths, so I think that women really need to go to a trusted health source, such as MacArthur Women's Health Centre, such as BreastScreen New South Wales, Cancer Institute New South Wales, their GP, and get information, that is actually correct.
So how do you see breast screening evolving over New South Wales in the next decade?
Right. Well, we have already made some strides. We have digital imaging, and a lot of women don't realise that we provide their mammograms via digital imaging. A lot of women still think that it's the old film X-ray. So digital imaging has been a game changer in terms of being able to get those quality images, and so that we can find those cancers because the images are much clearer. Also, in the future, we're looking at a one-stop shop for women in terms of their electronic records and all their results, even assessment results. Also, it's already started to, there's been a trial now with reading via AI, sort of things. So that's really helped with being able to provide accuracy over image reading.
Excellent. Yeah. Hopefully more cost effective too with all these advancements.
Absolutely. And radiologists, they're highly qualified, they're very busy. So to be able to have that additional mechanism to provide accuracy in reading women's images is fantastic and a game changer moving forward.
And so to anyone who's listening to this interview who may be postponing their screening, what would you like to say to those women?
Okay, early detection is your best protection. It's a 20-minute appointment and a mammogram only takes 5 minutes every 2 years, and it could actually save your life. Women often seem to think that if they don't do something that it will go away or it won't happen, which is not the case. If you delay having your mammogram and you do have a symptom, it will end up being more invasive and your treatment will be more invasive and your health outcomes will be poorer. So really early detection through a screening mammogram every 2 years is your best protection. All women, even if they're younger than 40, really need to be practicing breast awareness. Know the look and feel of your breasts. Anything that's unusual for you, do not delay. See your GP straight away. Okay. They're the main two bits of information that I'd like to impart on women. Yeah.
Excellent. And I will say I had my first mammogram at the Women's Health Week event that we partnered on that you mentioned earlier.
Fantastic.
And it isn't as painful as what I was told and was expecting. So I guess that's a message I'd like to share as well, that
fantastic.
It's not as painful as people tell you that it is.
The majority of women will say that it is a little uncomfortable, but it's 5 minutes. It's actually 5 minutes every 2 years. So it's, it really is a gift to yourself as a woman and to your family to make sure that you remain healthy.
Excellent. And so if a woman is wanting to book in a breast screen, what is the easiest way for her to do that?
Well, they can book online, which is very easy through the BreastScreen New South Wales website, online booking system, or you can call 13 20 50, or you can also pop into a BreastScreen clinic and the friendly receptionist will assist you. If you have any questions and you'd like to be able to ask them at reception, you can also do that.
Excellent. Sounds like a very supportive service.
Yes, and we also have the 13 14 50 telephone interpreter service, which is advertised on the BreastScreen New South Wales website for women who feel they would like that language support when they're making their appointment. And also our staff come from various backgrounds, multicultural backgrounds. We're very culturally diverse, so there's always someone within the service that can assist and support women wanting to book their breast screen.
That's fantastic. It sounds like you're doing everything you can to break down every possible barrier and make screening accessible for every woman.
Yes, well, we are trying. We are also looking at a fantastic, exciting project at the moment for women who are neurodiverse. And so we're looking at trialling a clinic and trying to make screening sort of more accessible and more comfortable for those women who are on the spectrum. And so we're looking forward to actually implementing that project. So watch this space.
That sounds great. Is there anything else that you would like to add, Tanya?
Yes, look, breast screening does save lives. It's 5 minutes. I cannot stress enough how important it is to just put yourself first, look after yourself, and book that mammogram every 2 years. Call 13 20 50 or book online through the BreastScreen New South Wales website. It will be, the best gift you could give yourself.
Excellent. And sometimes as women, we don't put ourselves first. So I think that is a great message that we need to get out.
Yes, absolutely. And you must value yourself. It's so important in this world where we are pulled every which way and women have so many demands from work, from family, from friends, etc., and that you put yourself at the bottom. But sometimes it's really important to put yourself first.
Exactly. We 100% agree here at MacArthur Women's Health Centre.
Yes.
So Tanya, thank you so much for sharing your insight, passion and commitment to women's health. Your work with BreastScreen New South Wales is an essential part of the holistic care model that we offer here at MacArthur Women's Health Centre. By helping women feel empowered, supported and informed and confident about the screening process, you're not only supporting early detection, you're supporting women's wellbeing. We're grateful for your ongoing collaboration and for the way that you tirelessly advocate for accessible, culturally sensitive and preventative care for women in our community. Thank you again for joining us today and for the vital role that you play here in the community of MacArthur.
Thank you so much for having me. Thank you.